No one from outside a community knows better like how to help a community than the people who live in the community.
When you listen to the youth voice, it will lead you to recognize that we are humans, which will then lead into better practice.
Do youth want to hear about? What do youth worry about? What do they need?
I used to suffer in silence before. I was always afraid, like people were going to judge me because I had anxiety or depression.
Nothing about us without us.
With the Youth Engagement Initiative, basically it's focused on collaborating.
The ability for like young people to, I guess, be able to lead programs and, tell service providers, I guess, that this is what young people need. This is what you need to be doing to make sure that your programs are not only effective, but also, I guess, taking even a step back from not effective, but also aren't harmful.
If someone had just asked me the right questions, it would have been a lot easier.
And it's really important because if you're going to design care services for youth, you need to involve them in the process because they're the ones that are going to be utilizing the service.
So I can go back to this business table with people in suits and be like, hey, listen, this is really important and it's something that a lot of people are experiencing, and make them understand and make them change the system so that the next 11, 12, 13-year-old doesn't have to go through that exact same thing.
So I wanted to get involved because I was struggling in silence and I didn't want anyone to feel that way because it's scary, and I just want more people to be aware of mental health.
It's not just a thank you for your advice, we'll think about it. It's okay, we're gonna implement this, or we're gonna take this up to the next group, we're gonna talk about it, and then we're gonna come back to you.
I wish I had that when I was younger, to know what mental health is, and I'm glad I'm working on a project that is able to help, and I wouldn't feel like an outcast, because a lot of people, they do go through it, and that's something that's you're not different, you're not weird because you have it.
There are long wait times, there aren't enough support, there are a bunch of different things going on that especially young people, when you're 11, 12, 13, it's how do I even know how to advocate for myself in this space?
I couldn't believe how common it is for people to have their parents in the room when they're with the psychiatrist. That's more than just me. And how common it is to not be able to not receive trauma-informed care.
I guess the main motivator for me to want to even become part of the mental health system or get into mental health advocacy was some of the not so great experiences that I think a lot of people have when they first start off in the system of feeling like you're not being heard.
And how we talk about that and then we're people need to hear that, and they do now because we're on this team and we're advising this various research and different people doing different things that will, unfortunately, doesn't change our past, but it changes for the people that are to come. And I know that sounds cliche, but it's the reality, and it's it gives, for me personally, it gives me purpose and it gives me hope.
It's really fun, actually, being able to be a part of something that's bigger than just showing up at a meeting once a week.